Hi, I'm Richie Arceo and I'm back for my follow-up treatment for last year's procedure. I think Doc made some procedure for my eye. And then for this year, it's going to be a follow-up and I think a new treatment or a new procedure. It's called the Collagen. Yeah. So just sit back and relax and just wait for the effect on this new procedure. Okay, just don't forget to subscribe and click the bell for more updates and notifications.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Ma'am Richie Arceo, welcome back.
Yes, hi, I'm back.
It's been a year when we did this so-called periorbital rejuvenation. So we work in the under eye area, the temple region, and of course the upper third, the forehead, the glabella, and a little bit of the nose thread lift, which is part of the anti-aging treatment right now, especially around the eye area. So it's been a year, Ma'am Richie. How are you?
I'm good.
So far, so good.
I'm good. So far, so good, yeah. But I need a follow-up.
Right, yeah. Because, you know, aging is a continuous process. Like in a year, we lose about 1 to 2% of our collagen. Actually, I have a textbook in biochemistry. It was telling me in a day, protein degradation is 1 to 2%.
Wow.
But in a day also, our own body will replenish the protein. But as we age, there's more breakdown than the production. As time passes by, like collagen, elastin, hyaluronic, all the components inside the skin dermis, what we call extracellular matrix proteins, they're getting depleted. So the production is less, the breaking down or the degradation is fast.
I know.
That's why like in a year, a lot of things can happen. But the good thing is when we have done a procedure a year ago, we have those absorbable products like the polydioxanone threads. So they dissolve in a year. But they also give a stimulation of collagen, a formation of collagen. So we had some hyaluronic substances. So somehow it helped within the year. That's why it's also important to do some procedures to, of course, replenish those molecules that we are losing. That's why today we're here, Ma'am Richie.
Wow,
okay?
So excited.
Right? But you look fresh. You look fresh.
I look fresh.
Natural beauty.
Thank
That's the
you.
thing that we want. For today, so we'll do again a treatment that will again rejuvenate the eye area around eyes, plus of course the part of the mid face and the lower face. Of course, on the upper third, when we check it, we check for lines, wrinkles, forehead lines, glabellar wrinkles here, and then we also check on the eyebrow, the upper eyelid. As we age, it droops down, but so far so good. And then the temple region, so we tend to lose volume here. So I noticed there's hollowness there, so we have to replace it again, or rather replace volume with hyaluronic substance. Then the under eye area, okay, if you do snap test there you go. So you'll notice the return to the original position is quite slow already. So we still wanna, you know, regenerate. And then in the mid face section, still good, but we're noticing some going down, sagginess, nasolabial fold here, and as we go on the lower third, the jowls here. And the nose is still beautiful. Actually, your nose is already naturally beautiful, okay? So for today, actually, we have this product we call Collagen. It's made up of pure collagen. 99.9% type 1 collagen. This is a type of collagen present in our skin, a mature type of collagen that will, you know, always restore support, and keep the skin tight, firm, lifted, plus on the surface wrinkle-free. So we have now a product we call like a pure collagen that we inject in the skin layer, in the skin dermis. Unlike the other products we were using before, the so-called collagen biostimulator, you are still waiting for collagen to form. Right now, we don't need to wait for the collagen to form. So it's already available and we can give it in the skin dermis. Plus this one can, like, you know, still give a natural result, and it will restore your skin the so-called extracellular matrix proteins. Yan. Then we'll also do hyaluronic on the temple and also collagen under eye and a little bit of refreshing Botox for Ma'am Richie. We'll show the procedure when we return. And we're back. So we're with Ma'am Richie. Okay. So the goal right now is also restore volume and also kind of replenish the skin with our collagen, a type 1 collagen. So I'll start working on the temple area. So I can already notice a hollowness. So like over time, we notice in the temple region, it becomes like concave. So ideally, we need to have some volume here. And when we do like a measurement of the temple plus the bizygoma, there should be like a straight line. But as time passes by, we notice that this temple area, it becomes narrow because of the so-called volume loss. So we're going to replace the volume, replenish volume with a volumizer we call a hyaluronic substance, which is a natural substance we find in our skin, in our body, in our tissues, okay? Now, for my markings, usually I palpate the temple fusion line and also this lateral orbital rim. And then 1 cm above and lateral, I do my injection onto the bone. Okay. Okay lang, Ma'am Rich. Ano lang po, tiny prick. Now, a while ago, we did cleansing of the skin. We applied topical numbing cream. We left it for about like 45 minutes. And then, after that technique, we also do a push, slow push. So, I'll be using just half ml of this product. Okay, so the goal again is to restore volume and somehow it will lift the corner of the eye because we notice the eye area becomes droopy as we have this volume loss on the temple. Okay lang, Ma'am Rich? Okay, after that, we'll also use a so-called Collagen product for the under eye rejuvenation. We have the so-called type 1 collagen and I'll be using a so-called cannula technique and I'll make my entry point here. Just a tiny prick lang po, ni-elixir. Okay. Then I have here my Collagen, and using this gauge 25 cannula, I'll just direct it. You can place it submuscular or underneath the orbicularis oculi. So just a fanning technique there. So the goal is just to restore collagen, also volume, improve the texture of the skin, the quality of the skin, and also the extracellular matrix there. So just a few of this, few ml. Then I'm just gonna also inject into this area here. So there are two planes you can place your product. You can place it subdermally and also submuscular. Okay, just a little bit more. And then after that, we'll also use a so-called Collagen again. This is now the Collagen hyperdiluted, so we want to inject it in the dermis layer. Okay, I'll start with the lateral area. I'm using a gauge 34 needle 2 mm, so the technique is just to inject it intradermally, creating like tiny blebs, or we call this bleb technique or intradermal technique or wheel technique. It's like what we call meso injection of our Collagen. You're okay, Ma'am Rich? Okay. So this one will help in improving the skin quality and tighten the skin, firm the skin, plus improve the texture, the tone. Yeah. So we have tiny blebs. Usually the blebs, they go away like we say 1 to 3 hours. Although some cases, like less than a day, it's gonna become flat. And Ma'am Rich has an event tomorrow. She's a school administrator in the clinic also, right? Health part. Yeah. There you go. So we've done this part here. So we can continue in the temple area here. Just tiny blebs there. There you go. We'll just continue with this side here. And then on the forehead, I can still place this product. I'll be combining the treatment on the forehead with botulinum toxin because I'm already noticing some lines, Ate Rich, okay, expression lines. It's normal. We get these fine lines and wrinkles over time, dynamic wrinkles, static wrinkles, it happens. So what we're gonna do is to relax them with your Botox, okay? So I have my botulinum toxin. So I'll work on the crowfeet area here. So the injection is intradermal. So we will just inject intradermally, and we can also improve the eyebrow position for those with brow ptosis. You can actually have lifting of the brow area there. So I'm just gonna continue both sides, intradermal. Okay, and then we can also do the procerus here, and then the corrugator left and the corrugator right, and then our frontalis muscle. So I notice more static wrinkles on the center forehead. Then let's do the right frontalis here, making sure that there is a good eyebrow position. We don't want to have the so-called spack brow. Then going to the left frontalis there. Okay, you're still good, Rich? Yeah. So multiple injections. Last time too, we did multiple injections, right? Yeah. Then we can still add under eye area. I use this to treat infraorbital wrinkles as well. Just inject in like a bleb in here. Okay, so we did this right side plus upper third Botox. Let's proceed to the left side. So we are done with our treatment. We'll show the result when we return. And we're back. So let's show the result to Ma'am Rich. The Rich. So we have a temporary skin blebs. So from the injection of the so-called Collagen, this is the intradermal technique. So usually these blebs, they stay like in an hour to 3 hours, but it will depend. Some people will still have it within the day. Some people have this fast healing. Some people will have slow healing. Okay, like in my case, I had it just like after 3 hours, it's already flat. Okay, so tomorrow it's okay. Like if you go back to work, you're fine. And then we did also the Botox on the forehead, the glabella, the sides of the eyes, and a bit under eye. And then we also did Collagen in the under eye. The Collagen under eye was the pure Collagen. It was not diluted. The intradermal was diluted with 5 cc of our tumescent solution. And we also did filler on the temple region. So simple procedures that we've done today just to kind of like help the skin quality, the skin condition, anti-aging, rejuvenation, revitalization, all of the above, right? So how's the experience, Ate Rich?
It's good. May konting parang kagat.
Right, yeah.
Pero
tolerable?
tolerable.
Yeah. When I had this too, parang yun nga, kind of tiny and bites.
Oh, yeah, bites.
And bites.
Yeah.
And we use a special needle. We have the so-called gauge 34 or gauge 35 needle, 2 millimeters only, which is actually the right depth, or what should we say? 2 millimeter is the depth for our dermis layer, like the papillary and the reticular dermis. So like 1.5 millimeter to 2 millimeters, we are in the right anatomical depth. Yan. Because we have to place it in the correct layer. We have to put it in the so-called fibroblast layer to really have that improvement of the so-called extracellular matrix protein. Sorry, I'm so masyadong medical, masyadong mga terms. Mahirap ang mga terms. Yeah. And then, we expect result like the Botox, like 2 weeks time. Day 3 is the onset of action. Now, the Collagen in the under eye, so some of my patients, when we do it after, there's like an instant like feeling in of any indentation or like a sunken area or hollow area. Even with the temple filler, we notice there's like an instant volume restoration and an instant lift of the corner of the eye. Now with the Collagen, because it's already a collagen, like days later, we're still noticing improvement of the skin quality, skin texture. There's also kind of like a brightening effect. So it's improving all the like collagen, elastin, hyaluronic inside the skin. Yan, part of the skin health. Very informative.
Yes.
Scientific. Yan.
Scientific.
Nasosobrahan. Okay.
Okay.
Thank you, Ate Rich.
Thank
okay.
you also, CSA.
So we will be observing the result. So we'll be sharing some photos, like day 1, day 2, day 3, day 7, day 14. By the way, this treatment, the Collagen intradermal, we recommend like a repeat after 3 weeks to 4 weeks, 3 sessions to kind of really have that stronger extracellular matrix area there. So we recommend 3 sessions every 3 to 4 weeks interval. Okay. And then after this, just do some like cold compress, okay? And no other like too much of not to do, okay? If you're into heavy exercises, not too much, not so strenuous, so you can still do your walking like that, okay? And then no history of allergies, so on the food it's fine.
Okay.
Not too much, okay? Yeah. So we'll see you again. Follow up. Yan. Is there any social media that they can follow you also?
Just Facebook.
Yeah, Facebook.
Yeah, just Facebook.
Yan.
Hi, you can follow me.
And follow us also. Our Facebook, FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. If you have any questions, you may email us at csaskinclinic@yahoo.com. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our videos at our YouTube channel, Contessa Salvador. You can check the episode with Ma'am Richie like a year ago, like 2 episodes, right? The periorbital rejuvenation together with the nose rejuvenation. Yan. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.